provoking, muscle ripping needles. Yes, to a small degree, these can sound as bad as they seem, but on a small scale, these same concepts can actually help induce a healing process in your body. I work at Acadiana Pain and Performance under 4 leading therapists in the field of biomedical dry needling. So, what I want to explain today is how and why this process of sticking a small needle in you can work and what it can do for you. Because in the end of the day, this therapy matters about how it can help heal you. For the next couple of minutes, I want to talk about certain subjects, and those are going to be how this needling works in a therapy process, what actually happens in the body that physiologically changes, and what it can do to help you short-term and long-term. So, according to Dr. Johnson, a therapist that has written many articles on dry needling, he says that it is the entrance of a small needle into a muscle belly at a tight spot, also known as trigger points, or what can sometimes be called muscle knots. It's almost as if a ball was sitting on your shoulder and it is really tight at that area. So instead of the muscle being at a consistent length, it is shortened and tightened up. Upon insertion of this needle, according to Dr. Abbott, a biochemist that led research in the field of dry needling, she said once this needle is inserted, it creates a physiological response that releases the tension in the muscle. This response will be explained more later, but it would be almost like a tightened ball just got disintegrated in your body and now it's loose. So as I explain this, I explain it as a muscle reset. And that's what we'll go into now when we talk about the physiology about what is this actual dry needling. According to Dr. Keeley, another biochemist that performs YouTube videos for the University of Colorado, he explained it that it is a process that needs to be figured out more on whether it is the mechanical tension that is released by the use of these needles or the inflammation response that is induced by these needles, or the combination of both. So, as I said, the way I explain it is I say to patients that walk in our clinic, that is the insertion of a needle in which creates these micro tears in muscles and resets the inflammation response in our body. A good analogy I use to patients and to people of common day life is that it is almost like having a clogged sink full of hair, nasty grime, plaque of some sort, or fatty substances, and you take a clothes hanger and you stick it down in that sink and clears out all the waste. It will release the pressure that's inside of that sink and then allow clean water to flow through. This is how our body acts on the inflammation response, along with a component of mechanical pressure released. So, what actually happens in the short-term instance versus the long-term instance? Well, I'm glad you asked, because this is what, at the end of the day, will be helping you. What happens is, on top of that physiological response, what you will actually feel is a needle going inside of you, but it is not pain-provoking at the time. What patients describe it as is a small pinching feeling, and then almost like a little stick is inside of your muscle. They don't say that it causes too much pain, and me, being a person who has done it many a times, I know it doesn't cause pain. But it is almost as if something is moving around, causing these mechanical releases. What happens directly after is there will be an increased range of motion and a feeling as if some sort of tightness has released, which in the end of the day, something has released. So the short-term acute events will lead into chronic benefits. The way that works is that it reduces inflammation in the body by go ahead and clean out the inflammation that was already there. So when you send clean water through a system, is as if the inflammation gets out as fast as possible. This will lead to long-term benefits that will cause a decreased risk in disease and a better overall lifestyle and a decreased risk in arthritis. Now that you know the chronic and acute benefits, I'd like to wrap up with saying that this is different from acupuncture because of the deep science that goes in behind it of actually knowing physiologically what happens. The physiological changes are what create this healing. And therapists will use this and continue to use a program to help heal you. This could be the therapy your colleagues, your friends, and even you need.